If you are over 50 and you go to bed feeling fine, but suddenly wake up in the middle of the night with intense shoulder pain, pay close attention. That pain that appears just when you try to sleep may be your body's way of warning you that something is not right. Many people assume it is simply fatigue, a bad sleeping position, or a temporary discomfort. But in reality, in some cases it may be a problem that needs attention before it gets worse. Perhaps this has happened to you. You lie down peacefully, try to settle onto your favorite side, and suddenly feel a burning pain in your shoulder that makes it impossible to rest. You change position, try to ignore it, but every time you place weight on that side the pain returns and eventually wakes you up. This is not something you should consider normal. In fact, among the causes I will explain today, there is one that requires medical attention as soon as possible. What is concerning is that many people spend months ignoring this warning sign. About 7 out of 10 people who experience shoulder pain during the night decide to wait, assuming it will disappear on its own. But when they finally seek help, the damage is often already advanced, sometimes even irreversible, and the treatment can become much more complicated than it would have been in the beginning. I am Dr. Gabriel Mena, and in the next few minutes I will clearly explain why your shoulder may hurt when you lie down to sleep. I will walk you through the 5 real causes that most commonly trigger this problem, starting with the most frequent and ending with the one that can become more serious if it is not treated in time. I will also share a simple test you can do at home to help you understand when it may be time to consult a specialist. Before we continue, let me warn you about something very important. If your shoulder pain is accompanied by shortness of breath, cold sweating, or pain that travels down the left arm toward the chest, do not wait. In that situation, you should seek immediate medical attention because it could be related to the heart rather than the shoulder. But if the pain stays mainly in the shoulder, appears mostly when you lie down, and you do not have those other symptoms, stay with me because what you are about to learn may help you understand what is happening in your body. Throughout my years treating patients, I have seen thousands of cases of shoulder pain. And there is something many people do not realize. The shoulder is one of the most complex joints in the entire body. It is also one of the most unstable. Unlike other joints, the shoulder allows an enormous range of movement. You can rotate your arm in almost every direction, lift weight above your head, push, throw objects, and perform countless daily tasks while the arm remains connected to the torso. That freedom of movement is remarkable, but it also comes with a price. That same complexity is precisely why the shoulder can become injured so easily and why pain can become more noticeable when the body is at rest, especially during the night. Now let us talk about the most common causes. And I would like you to pay special attention to the last one when we reach it, because it is the one most often misunderstood and, if not identified early, can lead to significant complications. The first cause, and by far the most common, is something known as rotator cuff impingement syndrome. To understand it simply, the rotator cuff is made up of 4 small muscles that surround the shoulder joint. These muscles play a crucial role. They keep the head of the humerus, which is the arm bone, properly positioned within the joint and allow you to lift and rotate your arm normally. The issue is that the tendons of these muscles pass through a very narrow space beneath a bone called the acromion. Every time you lift or move your arm, those tendons must slide through that limited space. Over the years, repetitive use of the arm and poor posture, especially if you spend a lot of time hunched forward or looking down at your phone, can gradually narrow that space. When that happens, the tendons begin to rub against the bone, creating what we call impingement. During the day, while you are active, your body often compensates for this quite well. Your muscles are working, you are constantly moving, and blood flow helps keep the joint functioning. You may feel discomfort, but many people can tolerate it. However, when night comes and you lie down, especially if you lie on the affected shoulder, the weight of your own body compresses that area even more. The tendons become trapped, inflammation increases, and the pain can become much more intense. That is why many people notice the pain precisely when they try to sleep. I remember a 56-year-old patient who came to see me very worried. He said, "Doctor, during the day I can work and move my arm, but at night I cannot lie on that side for even 5 minutes." After evaluating him, we discovered a rotator cuff impingement that had been developing quietly for quite some time. In fact, Several studies have shown that about 65% of people over the age of 50 have some degree of rotator cuff impingement, and most of them are not even aware of it until nighttime pain begins waking them up. You may be wondering if this could be happening to you. Some typical signs are quite clear. You cannot sleep on that shoulder, you wake up feeling stiff, or in the morning it becomes difficult to lift your arm above your head. And here is something very important to understand. If this problem is ignored for too long, the inflammation continues to progress. The tendons gradually weaken, and in some cases they may even tear. When that happens, treatment often requires surgery. Now let us move on to the second cause, which can be more subtle and deceptive because it may develop without the person noticing at first. This condition is called calcific tendinitis. In this situation, small deposits of calcium form within the tendons of the rotator cuff. Imagine tiny crystals building up inside the tendon. These deposits can act like small hard particles that irritate the tissue whenever the arm moves. During the day, movement helps maintain circulation in the area, which can reduce stiffness. But when you lie down, blood flow decreases, those calcium deposits remain in place, and inflammation may increase. As a result, the tendon becomes stiff, sensitive, and painful. One of the most puzzling aspects of this condition is that it often appears without a clear cause. There does not need to be a previous injury or trauma. It can develop slowly and then suddenly become noticeable. It is more common in women between the ages of 40 and 60, although men can also develop it. The symptoms can look very similar to rotator cuff impingement: pain when trying to sleep, difficulty lifting the arm, and discomfort when moving the shoulder. But there is one difference that often stands out. In calcific tendinitis, the pain can appear very suddenly and be extremely intense. Some people say they went to bed feeling completely normal and woke up the next day unable to move their arm without severe pain. When an X-ray is performed, these calcium deposits are usually clearly visible. They appear as small white spots inside the tendon, almost like tiny stones. Depending on their size and number, treatment can vary. In some cases, specific therapies are used to help reduce the inflammation and improve shoulder movement. And there are still several other important causes that may be behind that shoulder pain that appears just when you try to sleep. In a moment we will talk about other less well-known but equally important reasons that may explain why your shoulder wakes you up in the middle of the night. If this type of information helps you better understand what is happening in your body, consider subscribing to the channel and turning on notifications. That way you can receive each new video with clear and practical advice to care for your health, especially after the age of 50. My goal here is always to accompany you with simple information you can truly apply in your daily life. If shoulder pain appears precisely when you try to sleep and seems to worsen night after night, it becomes essential to understand what is causing it so the problem can be addressed in time. We have already discussed some common causes, but there are still other possible reasons behind that pain that wakes you up when your body most needs rest. Understanding them can make the difference between resolving the issue early or allowing it to progress into something far more complicated. Let us continue with what happens in certain cases of calcific tendinitis. In some individuals, the calcium deposits that form inside the shoulder tendons may eventually disappear on their own because the body is capable of reabsorbing them over time. However, in other patients this process does not happen naturally. When the deposits are larger or cause persistent inflammation, more targeted treatments may be necessary. These can include shockwave therapy, which helps break down those crystals, or in more advanced cases, medical procedures designed to remove them. Now let us move on to the third cause, and this one is directly related to something you probably do every day without even realizing it. The third cause of shoulder pain while sleeping is subacromial bursitis caused by posture. Inside the shoulder there are small fluid-filled sacs known as bursae. These structures act as natural cushions that prevent bones and tendons from rubbing directly against each other. One of these bursae sits just beneath a bone of the shoulder called the acromion. The problem begins when we spend many hours in a hunched-forward posture. This can happen while working at a computer, looking down at a phone for long periods, or even driving with the shoulders rolled forward. That position pushes the shoulder slightly forward and constantly compresses the small bursa that is meant to protect the joint. During the day, even if that posture occurs frequently, the body still has chances to compensate. You move around, stand up, and change positions, allowing that bursa to decompress for a while. But when night arrives and you lie down, especially if you sleep on your side, the weight of your own body presses directly against that inflamed bursa and the pain becomes much more noticeable. In recent years, this has become extremely common. We live in a time when many people spend a large portion of the day in front of screens. Research has shown that individuals who spend more than 6 hours a day using electronic devices have a significantly higher risk of developing inflammation in this part of the shoulder. The symptoms are often quite characteristic. Many people describe a sharp pain when they try to lie on that side. They may also feel discomfort when lifting the arm out to the side or a strange sensation as if the shoulder were swollen internally. The good news is that this type of bursitis often responds very well to conservative treatment. Applying cold to the area, using natural anti-inflammatory strategies, and most importantly correcting daily posture can significantly improve the situation. However, if it is ignored for too long, the bursa can accumulate excess fluid. In some cases it may be necessary to remove that fluid through a simple needle procedure. In more advanced situations the bursa may even become hardened or calcified, making treatment more difficult. I remember a 62-year-old patient who came to see me very distressed because she had been unable to sleep on her right side for months. When we reviewed her daily routine, we realized she spent most of the day leaning toward her computer and looking down at her phone with her shoulders rolled forward. With a few adjustments in posture, gentle exercises, and treatment to reduce inflammation, her pain improved noticeably within just a few weeks. Now let us move to the fourth cause, one of the most misleading because the pain appears in a location different from what most people expect. The fourth cause of shoulder pain while sleeping is compression of the suprascapular nerve. This nerve originates in the neck and travels along the back of the shoulder. Its role is to activate several muscles that help stabilize the scapula, the bone most people know as the shoulder blade. When this nerve becomes compressed, the pain that appears is usually deep and accompanied by a burning sensation in the back part of the shoulder. What makes this condition confusing is that the pain is not felt in the front of the shoulder as many people expect. Instead, it tends to appear in the back, between the shoulder blade and the spine. It also tends to worsen when the person lies down, because in that position the nerve may remain compressed for a longer period without relief. Compression of this nerve can occur for several reasons. Sometimes it develops from carrying heavy bags on one shoulder for extended periods. It can also appear in jobs that require keeping the arms raised for long stretches of time. Even something as simple as sleeping with the arm tucked under the pillow can increase pressure on this nerve. The typical symptom is a deep, persistent pain felt between the shoulder blade and the spine. Many people notice that the pain intensifies when they lie down, yet interestingly it improves when they move the shoulder forward or change position. If this nerve compression is not treated in time, the muscles that depend on that nerve may gradually weaken. Over time they may even begin to shrink, which reduces the stability of the scapula and can lead to further shoulder problems. Finally, we arrive at the fifth cause, possibly the most concerning and the one you should never ignore. This condition is called adhesive capsulitis in its early stage, more commonly known as frozen shoulder. It occurs when the capsule that surrounds the shoulder joint becomes inflamed and thickened. Over time, scar tissue begins to develop around the joint, gradually restricting movement. It is almost as if the shoulder slowly begins to lock. Frozen shoulder typically develops in 3 stages, and nighttime pain is often one of the earliest warning signs. The first stage is known as the freezing phase. It can last between 6 and 9 months. During this time, the pain gradually increases, especially at night, and you may start to notice that moving your shoulder becomes progressively more difficult. After that comes the second stage, called the frozen phase. During this period, the pain may decrease slightly, but the stiffness becomes much more severe. Lifting the arm, rotating it, or even performing simple movements becomes extremely difficult, almost as if the shoulder were stuck. If shoulder pain wakes you up night after night and you feel that moving your arm is becoming harder, it is essential to understand what may be happening before the problem progresses further. In many cases, when pain appears during sleep and mobility gradually decreases, it may indicate a condition that requires early attention to prevent months or even years of limitation. In cases of frozen shoulder, after the painful early phases comes a third stage known as the thawing phase. During this period, the body slowly begins to regain shoulder movement. However, this process can take a considerable amount of time. For some patients, it may last around 6 months, while in others it can extend up to 2 years. During this phase, mobility gradually improves, but there is something very important to keep in mind. If a person does not follow a proper physical therapy program, the shoulder may never fully regain its original range of motion. Many individuals go through this process for more than a year, sometimes even up to 3 years of discomfort, and nearly 40% never completely recover the full mobility of the shoulder. This condition appears more often in people with diabetes, in those with thyroid disorders, and also in women between the ages of 40 and 60. That is why I always tell my patients something very clearly. If you have diabetes and begin experiencing shoulder pain at night, do not ignore it. It can be an early signal that deserves medical evaluation. Early treatment is crucial. Depending on each case, it may involve anti-inflammatory medications, temporary use of corticosteroids to reduce inflammation, and a structured program of physical therapy. In more advanced situations, when the shoulder barely moves, specialized procedures may be required, such as joint manipulation under anesthesia or arthroscopic techniques to release the joint. Now I want to show you something very useful, a small test you can perform at home that may give you an idea of what could be happening with your shoulder. The first test is commonly used to evaluate possible rotator cuff impingement. Stand in front of a mirror. Lift the arm that hurts straight forward until it reaches approximately shoulder height, forming an angle close to 90 degrees. Then, using your other hand, gently push that arm inward so the shoulder rotates toward the inside. If this movement produces a sharp pain in the front or side of the shoulder, it may indicate rotator cuff impingement. The second test involves lifting your arm fully extended forward and then raising it upward, as if you were trying to reach the ceiling. If pain appears when the arm is between 60 and 120 degrees of elevation, this can also suggest impingement. The third test is related to bursitis. Press gently with your fingers just below the tip of the shoulder on the outer side. If you feel a very intense and localized pain in that spot, it could indicate inflammation of the bursa. Now comes the most important test when frozen shoulder is suspected. Try to place the hand of the affected arm behind your back. First attempt to reach from above, as if scratching between your shoulder blades. Then try reaching from below, as if placing your hand in your back pocket. If you cannot perform either movement or notice that your range of motion decreases week after week, it is possible that you are developing frozen shoulder, and it would be wise to seek medical evaluation as soon as possible. If the tests you performed suggest that your pain may be related to impingement or bursitis, there are several simple steps you can begin taking right away. First, and although it may sound obvious, avoid sleeping on the shoulder that hurts. Many people continue putting pressure on that side during the night, which worsens the inflammation. A helpful strategy is placing a long pillow or body pillow in front of you to prevent yourself from rolling onto that shoulder while sleeping. You can also apply ice to the shoulder 3 times a day for about 15 minutes each time. Cold therapy is very effective at reducing inflammation. Gentle stretching exercises can also help. One of the simplest is the pendulum exercise. Lean slightly forward while supporting yourself with your healthy arm on a table or chair. Allow the affected arm to hang relaxed and gently move it in small circular motions for about 2 minutes, 3 times per day. During this time, it is best to avoid movements that require lifting your arm above your head, such as reaching high shelves or hanging clothes in elevated places. Give your shoulder the opportunity to calm down and reduce the inflammation. In some cases, anti-inflammatory medications may be necessary, always under the guidance of your doctor. There are also natural foods with anti-inflammatory properties that may support your body, such as turmeric, ginger, garlic, and onions. Another factor that often makes a big difference is correcting your daily posture. Try to keep your shoulders back, your chest open, and the screen of your computer or phone at eye level. Simply improving these habits can help prevent a large number of shoulder problems. I clearly remember a 58-year-old patient who came to see me convinced he would need surgery because the pain no longer allowed him to sleep. After evaluating his case, We discovered that much of the problem was related to his posture and the way he slept every night on the same shoulder. With a few adjustments to his sleeping position, gentle exercises, and physical therapy, he began sleeping much better within just a few weeks. However, if after 2 weeks of following these recommendations the pain does not improve or even becomes worse, it is important to consult a specialist in orthopedics or shoulder conditions. Many of these problems can be fully resolved with physical therapy when they are detected early. But if they are ignored for too long, they may eventually require surgery. Now I would like to hear from you. Tell me in the comments exactly where you feel the pain in your shoulder. In the front, on the side, or more toward the back. Reading your experiences can also help other people who may be going through the same situation. If this video helped you better understand why your shoulder may hurt when you try to sleep, I warmly invite you to subscribe to the channel, turn on notifications, and share this information with someone who might benefit from it. Every day we publish new videos with clear and practical guidance to help you care for your health, especially after the age of 50. And before we finish, I would like to invite you to take a small moment to pause and give thanks to God for life, for the opportunity to learn something new each day, and for the chance to care for our bodies with greater awareness. Knowledge is also a form of health, because when we understand what is happening in our bodies, we can make better decisions. Thank you for being here with me. On Dr. Gabriel Mena's channel, we are truly happy to help more people improve their habits and protect their well-being. Tomorrow we will have a new video with simple advice that can help you live with better health and greater peace of mind. I hope to see you there, because here you will always find information created for you and for the people you care about.